If you are getting close to age 65 and becoming eligible for Medicare, you probably have a bunch of questions. So let me cover the key points with you. You'll find that there are differences between Medicare and your current employer-provided health insurance. So let's build our Medicare knowledge and make you more confident heading into those decisions. Let's start by explaining the parts and costs. And yes, there are costs to Medicare. Medicare is not free. Fidelity estimates that the average person on Medicare will pay about $6,400 each year for healthcare. But there are moves you can make to lower your costs and make them more predictable. I'll touch on that in a minute. First, a few basics. Unlike employer health insurance, all plans are individual plans. So if you have a spouse or partner, they won't be covered by your Medicare plan. They will have to enroll on their own. You can sign up beginning 3 months before you turn 65, or if you plan to work past age 65, you can enroll when your employer health care ends. There's also an annual enrollment window. It's very important that you enroll on time. Otherwise, you'll pay an ongoing late enrollment penalty that will drive up your Medicare costs. The second key thing to know is that Medicare isn't one plan. There are actually 4 parts to Medicare. Original Medicare is made up of 2 parts, Part A and Part B. Part A is hospital insurance, covering things like hospital visits, eligible treatments and procedures, and hospice care. Part A doesn't have a premium, but there's a deductible you pay first for each hospital visit. Part B is medical insurance for doctor visits, outpatient hospital care, physical therapy, lab tests, and medical equipment. You'll have a monthly premium that varies based on your income, and you'll pay about 20% of the cost of the medical services you use. We recommend you contact Social Security to enroll in Part A and Part B and determine how you'll pay for it. Usually the premiums are deducted from your retirement benefits, although direct bill is another option. If you already receive Social Security retirement benefits, you're automatically enrolled in Part A and Part B when you turn 65. If you are worried about having the cash on hand for your out-of-pocket costs, you can purchase a Medigap policy. This is an insurance policy meant to cover these gaps in original Medicare. You pay a premium to a private insurance company, then they cover the out-of-pocket expenses related to Part A and B. This can help make your expenses a little more predictable, which is nice when you're on a more fixed income. Let's skip Part C for a moment and cover Part D, which covers prescription drugs. You'll want to find a provider whose plan covers the prescriptions you're taking. Watch this every year, as the covered medications can change. Just like employer health care, you'll have premiums and deductibles to pay for Medicare Part D. All of this feels like a lot. You're not alone. It can be at first. That's why some people choose to purchase Medicare Advantage coverage, which is sometimes called Medicare Part C. It's an all-in-one managed care plan that provides the coverage you'll find under original Medicare and Medigap, and can also include Part D prescription drug coverage, vision coverage, and dental care. Sounds great, right? Just be aware that Medicare Advantage plans provide coverage for what's called in-network services, which means you must use doctors and providers who are in the plan's network. So you may need to switch doctors if you choose this option. These medical costs are another reason why it's important to save as much as you can in your retirement plan. If you're enrolled in a healthcare plan that's eligible for a health savings account, consider saving those HSA dollars for healthcare in retirement versus spending them now. Figuring out which Medicare options are right for you will take some time to think through. You'll want Parts A, B, and D, and most people will want either Medigap or Medicare Advantage. A Medigap policy may be right for you if you prefer to pay an additional premium instead of paying for more out-of-pocket expenses. But if you feel strongly about choosing your own doctors and providers, then you may not want a Medicare Advantage plan that restricts you to in-network providers. Now, if you plan to live in different places during a year, you need to make sure that there are in-network doctors in both places. Regardless of what options you choose, remember these 2 tips to help you avoid paying more than you need to. First, check to see if you qualify for any low-income discounts. And second, be sure to enroll in each Medicare Part on time. You'll absolutely want to avoid any late enrollment penalties. As you get closer to age 65, start using the helpful resources on Medicare.gov. You can also learn more about each part, including tools to help you find and select plans.